Well, we're living in a pandemic that right now only seems to be getting worse. And because of that pandemic, parents around the country are delaying wellness checkups for their children. Talking about visits where kids get shots for preventable diseases like the measles or whooping cough. Here in Chicago, local health officials and organizations are seeing a slide in childhood immunizations. In some neighborhoods, up to half of the children in childcare are missing required vaccinations. In a few minutes, we'll check in with folks from the local healthcare clinics who are raising the alarm about this. But first, joining us now to discuss why childhood vaccination rates are falling in Chicago and what's being done to address the issue is Cassie Walker Burke. She's bureau chief of Chalkbeat Chicago, a nonprofit news organization reporting on education in the city. Cassie, welcome back to Reset.
Thanks, Justin.
So what made you look into this issue and what did you find?
I accidentally stumbled on it, actually, when I was looking at data for another story I was working on early childhood centers. So Chicago has hundreds of publicly funded childcare centers around the city, and there's all kinds of data that you can get about the children that are in them, and they tend to be low-income kids whose parents qualify for a subsidy for childcare. Mm-hmm. And so I saw this immunization data, and I had seen some national warnings that vaccination rates were slipping. And when I saw the Chicago data, my jaw literally dropped. And one of the reasons is because historically, Chicago has actually had pretty high vaccination rates compared to other cities. It was sort of a point of pride.
Yeah, I was surprised by that.
Here.
Yeah, 96%, 97% or something like that. Yeah.
It's close to 95 actually, but that's pretty high. So that's just looking at measles, the MMR vaccine. And so I started looking around, and I waited actually a few months on the story, and I looked at the data again, because I know even as a parent that trying to get your kids in to see a doctor in the middle of a pandemic for children who are well was maybe something that parents weren't doing. But when I saw the numbers were still low toward the late part of summer, then I started a story. And there's a few things that are going on here, right? Where there's a slide in vaccinations, which is saying there's access issues. But we're also seeing some other things that are coming up. We're seeing a resurging distrust of vaccines, which is problematic on a whole lot of levels. Right. And then you're also seeing that vaccines are really a proxy issue for access to pediatric health care. So kids aren't going in and they're not getting vaccinated. They're also not seeing the doctors for screening for developmental delays, for autism, lead poisoning, and really scary child abuse.
Yeah, in the story I was reading, I was surprised, and it's not surprising. It's not shocking. I guess it's not stunning when you think about it, but there's a distrust of the medical community because of racism in the past. And many people who may be from Black and brown communities in Chicago see it that way, that they're not necessarily whatever the doctor says goes.
Right. There's concern that this sort of lingering or latent distrust is starting to rise. And part of that is the political, the way we've talked about COVID politically, the fear of vaccines. And so how the city addresses this issue now, and not just the city, but, pediatricians and how this issue gets addressed now on the childhood side could actually have ramifications for uptake on an adult vaccine should once an adult vaccine arrives.
One thing, just kind of like off the top of my head, when I think about it, I'm like, knowing, having a 13-year-old son and how vaccinations have worked, a lot of times they're tied to school. They're tied to, you can't get into school if you don't have your measles, rubella, if you can't get into the daycare center if you don't have these vaccinations on your card. So why is that off this year? Is it because of COVID?
It is. So the October 15th deadline was sort of a well-worn, schools knew kids could start the school year, but if they didn't have their paperwork by October 15th, they had to go home. And that was a deadline that really helped a lot of parents, get things done. Well, the state essentially said to districts, if your kids are learning virtually, which as we know, Chicago Public Schools is completely virtual now, then the October 15th deadline doesn't essentially go into effect. They said, technically, you still have a deadline, but there's no enforcement mechanism on it. And so I think that sort of hard deadline, which a public health expert said was, something that was very helpful, has now become a soft.
Is that possible? Like, deadline. Let's say that the CPS gets back into the schools by, the winter, spring at some point. Will the numbers that you're seeing go up because there'll be mandatory requirements for vaccinations?
That is the thinking. I don't know how long they would extend the deadline or what that would look like. But I think you also have to look at how the other side of this is that the pandemic has also affected where people can go to get vaccinations. So before the pandemic, the city had 5 different sites that were actually free vaccination clinics. And so this is for the underinsured, the undocumented. And then there was also a mobile van that went around. The pandemic actually shuttered the sites and stopped the van. Now, 2 of the sites were back up and running as of September, and the van was back up and running. But I think you have to also think about the access side of the question.
Right. No, you're absolutely right. That you don't think about that we close those spots down. That's a big part of why you're seeing this trend or that high percentage drop.
Right. And so I think that the issue now is how do we get out the word, or how does the city get out the word, both to pediatricians to say, okay, whatever system you're using to reach out to families, it's time to make sure you're doing that, right? Are you text messaging families? Are you reaching out to them? And so thinking about how do individual doctors and doctors' offices do this sort of practice, restarting the sites. And then also, I think it's really interesting that the city has historically relied on sort of a grassroots organizing approach to send people out to communities to have conversations about, sometimes it's childhood vaccines, sometimes it's the flu vaccine, sometimes it's something like the HPV vaccine. And so remobilizing that sort of grassroots approach and having conversations on the ground with people about why vaccines matter in this moment, helping connect them to clinics and resources. And so it really can't be just one strategy, and it never has been. But I think the pandemic interrupts those strategies. And so the city has to sort of retool.
Well, whenever we're talking about vaccines, obviously we go to COVID-19 and the obvious everything that's happening to lead up to a vaccination and or vaccine and the distribution of that vaccine. Are local health officials worried that there will be a similar trend once COVID-19's vaccine is approved and distributed?
Health officials right now are putting together plans for what happens when the vaccine comes through. And we have to also remember that right now the discussion is about a vaccine for adults. We're not even talking yet about a COVID vaccine for children. And that is one note that I thought was really interesting in all of my interviews. That seemed to actually be a point of concern for health officials. As they work together their plan, as they were starting to put together their plans, what about a vaccine for children? We're not even talking about that yet. And so as a country, and so that to me seemed to be the note of concern that I heard. Again, Chicago has had this history of having this multi-pronged way of spreading the word about childhood vaccinations. And there was some thought of using a lot of that to try to do similar things for the COVID vaccine. But again, if you don't have a vaccine yet for children, even in trials, what is that going to look like? And how is that going to affect things like schools reopening and staying reopened?
Yeah, absolutely. Always great. Cassie Walker Burke, Bureau Chief of the Education News site Chalkbeat Chicago. Cassie, thanks so much for your time today.
Thank you.